Hello and welcome to medicsvoices.com, where we talk to the key opinion leaders in health and medicine around the world. Today, Andy Haynes in the UK is talking to Airton Stein in Brazil.
I really wanted to start by asking you how you got into primary care and why you decided to go into primary care, because it was still quite unusual in Brazil at the time when you started your career. So perhaps we can start from that point, and I ask you to reflect on those early years of your career.
So I chose primary health care as the setting of my medical practice through a combination of early exposure as a teenager. As a Brazilian, one can easily identify that the main problem in Brazil is living in a very unequal society. And I have identified that I could help improve this situation somehow as a family physician. Even before medical school, I had been engaged in community activities for vulnerable communities. And being a medical student, to be honest, in Brazil from 1976 to 1981 meant studying under a military dictatorship when universities were tense spaces with limited freedom of expression and a sense that politics was always close at hand, even if not openly discussed. Training was very hospital focused, with little attention to primary care and social issues, despite clear inequities in access to care. So that's this scenery. That's why I chose primary health care. This period, first signs of a broader movement towards a more universal and equitable health systems, even during these medical school years.
Yeah. Great. Well, that takes me into the second point I really wanted to ask you about, which was the early years of the family health program, the PSF program,
Mhm.
and maybe after we get through the early years, how it's evolved over time. But let's start with the early years of the family
Yes.
health program.
Well, during my training in family medicine, I became increasingly aware of how many community health needs remain under beyond what I could address in individual consultations. And even though I had a very good training in physical and mental conditions, while considering social determinants, it often felt insufficient in the face of broader persistent gaps. And the family health program tried to accomplish this. And it was interesting that I have realized that causes of the causes, which drew me towards training in epidemiology. At the
Mm.
time, the field was gaining strength with inspiring professors like Bruce Duncan, Maria Inês Schmidt, leading the teaching of clinical epidemiology and editing one of the first primary healthcare textbook in Portuguese. And Andy, you have contributed as well in this book, and it was a very um, game changer, game changing. Up to that period, most books were from the US, and
Mm.
of course, the context was completely different. And primary healthcare was not presented as a valued career path during my medical training, and it was rarely recognized as a legitimate medical specialty. And primary healthcare really started when the federal government identified local experiences, such as the one that I was involved in Porto Alegre, the Conceição Hospital experience in community health, and there were, of course, several good experiences throughout the country, but very isolated. And the federal government then stated that uh, it should be a priority for the health system. SUS, the National Health Service in Brazil, that was starting, and primary health care then was put a lot of emphasis on family health strategy. And so this was uh, one of the reasons I decided to go more into epidemiology and how to do research to identify the benefits of the family health program. And there were several research carried out by several researchers from Brazil and from elsewhere to identify the impact in the quality of life, in fact, by of the Brazilian population after the implementation of family health program. And by 2024, the family health strategy had achieved coverage of approximately 80% of the Brazilian population. And a substantial body of independent research indicates that it has been effective, demonstrating improvements in primary healthcare sensitive conditions, performance measured by primary care assessment tools, PCA tools, increase, for instance, indicators such as increasing breastfeeding rates, high immunization coverage, and despite advances, important challenges remain, particularly in addressing the growing burden of chronic diseases, where a still fragmented health system has limited effectiveness. And I
Yeah,
think this is the major issue. The um, the Brazilian health system has improved quite considerably in relation to infectious disease and maternal and child care, but chronic diseases, which uh, is a high burden and uh, the mortality rate uh, is is still high due to chronic diseases, and the health system is not well prepared for
mm,
this epidemic of chronic diseases.
yeah,
So this is always a challenge, and I
always.
think it's not only in Brazil. It's you have to have a much more structured health system to deal with chronic diseases.
Absolutely.
It's,
And I mean, how important do you think the contribution of the community health workers was? Because when I first
oh,
came to Brazil, one of the things that really interested me and also impressed me was the role of these community health agents, as they're called, recruited from the
yeah.
local community with responsibility for a defined number of families. And I thought they were such an important member of the primary healthcare team. And in fact,
Mm,
there's been when we first came to Brazil, we were obviously trying to communicate the way in which general practice was run in the UK. But of course, more recently, we've also tried to import some of the ideas, innovations from
yes.
Brazil into the UK, particularly the idea of the community health worker model through people like Matthew Harris and so on. So it's a two-way process of learning. I wondered what your reflections were on the importance of the community health worker approach.
Mm. It's a two-way street,
Yeah.
and we learn as a medical student scientific language. But when we interact with the patient, you have to address in a way to communicate well. And sometimes schools they don't provide these skills on how to address. And community health workers is specialized on how
Mm,
to communicate
mm,
with everyday problems and everyday needs. And I was reading about Ebola epidemic in Congo and Uganda, and people are very poor in these areas and isolated. Schools are out. Health care service are uh, are only available for treating Ebola. The other problems they don't care. They don't have time to be involved. And the main problem that no one is really talking about is violence against women and girls in this period of Ebola outbreak. And that's a big problem in Brazil nowadays. Uh, Violence against women is a major problem, and I don't see um, the physicians and the health team well prepared to deal with it, as it's very complex, very difficult to deal. Um, People and very quick consultations, they only deal with reason for encounter, not the main issues such as how to deal with these complex problems that community have to solve, especially during financial instability, and people focus only on how to survive. It's a
Yeah.
survival kit
Yeah.
nowadays, is in countries, especially in vulnerable populations.
Absolutely.
And
I was wanted
uh,
to, because one person who really helped us to understand more about people's beliefs and how to communicate was Cecil Hellman, the great Cecil
yes.
Hellman, anthropologist and GP. And I wondered if you could say a few words about Cecil's contribution, because he was extraordinarily talented in understanding the needs of individuals, but also the community. And I'm sure that he would have
Mm.
engaged in the topic gender violence, for example, would be one in which he was deeply concerned. But he had a very, I think, wide-ranging impact through his work in
Yes.
Brazil, which I think complemented the kind of epidemiological approach with the anthropological approach.
Mm. Well, I enjoyed very much Cecil. He was a good friend, and he stayed in my house when he came to Porto Alegre, and it was very interesting to see uh, his mindset. And one of the aspect, people tend not to highlight very much folk healers in the community, especially medical professionals. They think it's a waste of time. You should not rely on these people. And he wanted to learn the beliefs.
Mhm.
And one of the things that I recall, one of his lecture was, as physicians and health professionals, we want to provide screening, for instance, to identify cervical cancer. And Cecil would state, people want to survive day by day. They are not worried about cancer in some years down the road. Timing is essential on how to deal with people who have a different priority. Uh,
Mhm.
as physicians, we want to improve prognosis for middle and high income people, not the poor ones who survive. They don't know if they are going
Yeah.
uh, to die in the end of the day. Yesterday, in Rio, there was a case that two workers were killed by the police, and the police killed because he was using a tool in the bag, and the police thought it was a gun.
Hmm.
And they were in a very poor neighborhood.
Mm.
So when you're in a poor neighborhood, you're more likely to die, not due to chronic illness, but due to police intervention, not
Yeah.
well conducted. So
Yeah. Absolutely.
this is the setting, and another thing. When I did my MSc at the London School of Hygiene and Tropical Medicine, I was complaining to Cecil, "Oh, my good friends from Brazil, they don't uh, keep in touch with us, with Magda, my wife, and myself." And he stated, and at that time it was much more difficult than nowadays. It was just by letters to keep in touch. And he said, they are in a civil war.
Mm.
They don't have time to uh, talk with someone who is not in the setting. And this is something that we have to take into account. The local, what happens in local area is essential.
Yeah.
There's always a saying, when I address a lecture, I always say, you have to think globally and act at local level.
Yeah.
And adaptation is a skill very relevant, especially for those who want to apply evidence-based medicine. You have to, of course, rely on the sound studies, but you have to take into account the local area, the context. And it's interesting, even in a city like Porto Alegre, a teaching hospital is completely different from another hospital that takes care of public of the National Health Service, which is not a scientific-based hospital. It doesn't do research, and the environment is completely different.
Mm.
I attended a lecture by in this teaching hospital, and a specialist in genetic. Uh, she was saying that when uh, high-level scientists come to the hospital, they don't rely as much as she thinks these uh, s- uh, scientists from a developed country relies, and uh, and she was identifying that the hospital has all the means to provide good level of care. And sometimes the environment, the context of a medium level country, sometimes it's the reason that it's not reliable for someone who comes from a different high level. So even though what I'm trying to address here is that you have to take into account the context, not
Mhm.
only what you do
Yeah,
locally.
absolutely. And I suppose also that translation from the generic and the high level
Yes.
to the local is very important. That your new enthusiasm or your recent enthusiasm for the planetary health concept and how you translate that into local action is that's also very relevant there.
And especially after the COVID situation in Brazil, where um, the um, denial about
Mm.
the vaccine effectiveness and lack of overall planning for the whole country, it was a mess. And it's interesting that I always identify that uh, um, uh, this denial causes big problems in society as it's very polarized, and that's the most important aspect is how to approach the community needs,
Yeah.
how to identify the priorities and try to communicate as well as possible.
And that brings us
And
back also to the community health workers because they are selected from the community and they're the best people to
yes,
communicate evidence in their own way to the community.
mm,
And they also can help build up trust between the health system and the broader community, often people who have been marginalized by, current structures and so on. So they again play a very important role in that. I'm
yes,
going to now bring you to right up to date and ask you really about the lessons from Brazil. How can they apply, or how can they support other countries aiming to develop primary healthcare? Because at
mm,
the beginning, I guess a lot of the ideas of the primary health program were developed in Brazil, but there were external influences as well from other countries, from Canada, from Cuba, from the UK. But now, of course, Brazil is
Costa Rica was a
and Costa
very
Rica, Costa
uh,
Rica as well. But now, of course, Brazil is seen as a great international model.
mm,
And many
yes.
people come to Brazil and look to Brazil for leadership. So, could you just say a few words about what you think the lessons are and how Brazil can help
Mm,
other countries develop primary healthcare?
yes. Well, Brazil's experience with primary healthcare offers valuable lessons for countries seeking to strengthen their system. Meaningful progress is possible even amid political, economic, and social constraints when there is sustained commitment from key stakeholders, particularly under the leadership of general practitioner. And this is something that I always stress. And we're going to have a national conference of general practice in Porto Alegre after 22 years. So it will be very interesting next year.
Mm.
And general practitioners should be identified as leaders in the community and, of course, in the health system. And evidence shows that scaling up primary care through a coordinated national strategy rather than fragmented initiative combined with multidisciplinary teams responsible for defined populations is highly effective. And community health workers is a distinctive and impactful feature of Brazilian model.
Mhm.
Decentralization has been crucial, allowing local authorities to adapt implementation to their specific context, and a substantial research demonstrates that adherence to core primary care attributes described by Barbara Starfield, who defined the core elements of primary health care, such as access, continuity of care, coordination, cultural competence, is essential for achieving effective and equitable health systems. So I think even though there are ups and downs, Brazilian experience emphasize in real life experience that it's very effective, and it has been shown by research done
Mm.
by Brazilian researchers and from other countries research, so independent research. It wasn't government based research showing the importance of primary health care.
Yeah.
Even though, having said that, I have talked with some Brazilian general practitioners. Brazilian currently faces significant structural, financial, and systematic challenges that I wanted to highlight. In discussing with some colleagues actively in working in the field, the system remains unable to adequately address key issues, including weak career structure in general practice, precarious employment contracts, low team stability, and poor continuity of care, often not prioritized by managers. And there are some other concerns, including heavy workloads, high stress by all the team, limited access to secondary and tertiary service, and high turnover among younger physicians. These factors contribute to a fragmented systems with inadequate information infrastructure, limited implementation of clinical guidelines, poorly coordinated referral pathways, and shortage of essential medicines and diagnostic resources. So there, the situation, uh,
Yeah.
it's not all uh, of course, it's difficult to identify. There are very good experience. There are primary health care that are supported by the government, local government, that are very effective, and people are very um, happy on working in primary health care in certain areas. But
Mm.
I would say these are the exceptions. These
Yeah.
are uh, 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 places that are shown successful stories that are presented in research papers. But
Yeah.
overall, this is the picture, not very
Not so,
glamorous.
no. No, there are still very difficult challenges. On the other hand, when you look back, say 40 years ago, we've come a long way. And so one also has
Yes.
to compare it with what it was like all those years ago. And there have been big improvements, although, of course, as you say, there's still a long way to go. So let me just conclude really our interview just by asking you to reflect a bit on your current stage in your professional life. And you're no longer in clinical practice, but you're still very, very
Yes.
active. Could you say a few words about what you're doing, how that relates to your earlier experience?
I'm amazed that I've been invited to several medical schools, uh, family practice residency programs to address about guidelines and about planetary health and
Mhm.
how to pursue a career in general practice and the importance of primary health care. and I'm still involved in research and and I've been in contact with a very high level methodology uh, researchers from around the world, and I'm quite happy to share this experience with, especially with residents, and I've been invited to discuss journal clubs to critical appraisal of
Mm.
research in internal medicine and gynecology.
Mm.
And I've been supporting these two groups due to a good relation with colleagues from these specialties more than my expertise in this
Mm.
area. But I'm interested in developing critical appraisal in medical career, uh, and and so I'm happy to help locally that there is a need to improve, and I see, especially in Rio Grande do Sul, after the extreme climate event,
Mm.
even comparing to other states in Brazil. And it used to be a very developed area, especially in terms of capacity building in the state for uh, people who were trained in universities and residency trainings in the state. They could compete in everywhere in the country and elsewhere. But nowadays, it's low profile, and it's something that one has to identify what has happened to this local environment that was so fruitful that has lost the track. So I'm
Yeah,
trying to help to reflect and also to improve local conditions and to uh, to have self-esteem. This is really important, and
yeah,
also to identify local needs. And
absolutely.
a bottom-up approach is my theme, my main area. People try to identify the top level, the ones who can say nice things, but the most important aspect is bottom-up approach. That's what we learn in primary healthcare, isn't it?
Absolutely, Ayrton, and you've alluded to these very powerful floods which really devastated Rio Grande do Sul, and so I think your work really exemplifies how you're linking these planetary level crises and changing climate and so on. But as you say, focusing very much on the lessons from primary care, which is about bottom up community engagement, working with colleagues to improve the conditions on the ground. So thank you so much for your inspiring
Yeah,
career and all the work you're
yeah, thank
continuing
you.
to do. It's been absolutely wonderful to talk to you again, and our friendship's gone on for so many decades, and we look forward to many more years of friendship and collaboration.
Yes.
Thank you so much.